Hi. Today I wanted to talk about five key factors that can affect fertility or conception. And they're ones that some of you already know, like they'll usually talk about age-related issues. And age can play a part, but it also depends, I would say, more on how you've lived your life so far. What have you done that could have, or I should say, what situations have you been in that might have increased toxicity in your system or stressed your system further? If you were on medications as you were growing up, there's a lot of different things that can play in fertility and affect, it's like not the age itself, I think, that plays into it as much as what other factors could be making your body feel more aged. So I wanted to kind of walk through those because you already worry about, oh, I'm over 35. So that's going to mean certain things are going to take place. But I'd say more importantly is looking at what factors to ask your doctor for. Because a lot of times you'll be wondering if you should go in and see your doctor. But then when you're there, you're like, I don't even know what questions to potentially ask besides, why am I not getting pregnant? So, this is what I wanted to make sure you're thinking of when you are broaching, talking to a doctor, and figuring out where you need to make changes. If you have a partner that you're working with on this, where does he need to make changes? And what the impact is in the first place, because a lot of times you're just being told to keep having sex, which is important at the fertile times, but if there are big factors that are impacting that ability, you need to address them first before you're going to have a positive pregnancy. So I just wanted to walk you through those five different areas. Age is one of them. But like I said, I don't think that in and of itself, age is as much a factor. I mean, yes, of course, if you're not producing hormones anymore, then you're going to have to look at that. But more importantly is what's causing those hormones to go down or be affected. And so that's what I really want to talk about. With lifestyle habits, that's kind of a biggie because if you're if you're not eating well, if you are having, like alcohol or coffee, or your dietary, your daily meals are not optimal. You're not getting enough of the nutrients your body needs. You're not giving it enough of the whole nutrients. And yes, some supplements can actually be really good, and I do advise people to supplement, but that's a different category I'm going to get into with supplementation. So looking at what your diet has. A lot of times there's inflammatory factors you don't even realize exist. You could have sensitivities to certain foods that you're not aware of, which affect your gut, which can in turn affect your hormones. There's a lot of things that are dot connecting. And so you're trying to figure out what is impacting these areas the most and what can I do to fix it. So that's what I want to talk about is most of the time I'm telling my patients to get on more of an anti-inflammatory diet. At least start there. So you're making sure that the foods you take in are not going to be problematic. And so if you want to look it up, you can do a Google search for Mediterranean diet, but make sure it's an anti-inflammatory Mediterranean diet. And normally you'll get a pyramid looking shape, where the top foods are the ones you should have the least. And then as you get to the bottom, they're ones that you want to eat the most of because they're going to be the most nutrient rich and helpful for your system. And so that's one that I usually advocate for because I think it covers a lot of areas. But the other problem can be if you have a lot of sensitivities to different foods, you have to take that into account as well. So make sure that you're either getting allergy tested, a good allergy test that's not just the ones that like a peanut allergy or chocolate allergy where you go into anaphylactic shock. But sometimes there's foods that after you eat them, you do notice that you have a little more GI distress. So you want to avoid those. Give your body time to have that not be so much of an allergen or inflammatory factor for you. So that's some of the things to kind of keep in mind with your food is changing your diet for the better, avoiding those things that are going to be more toxic to your system. And so that includes alcohol and even coffee. A little bit of coffee is okay, but I'm usually telling people to watch out for toxins because mycotoxins or molds are a lot of times ground right in to the beans, or they're when you get your package, if you have ground coffee, if it's not a mycotoxin tested or environmentally tested coffee, there's a good chance that you're also getting mold in your coffee, which is really gross. But it's something to be mindful of. And so it gets a little bit more expensive trying to find mycotoxin tested coffee, but there's some out there. So if you just really need to have your coffee, and even if it's just half a cup, make sure it's good. It's a good coffee if you're going to have it. The other areas besides your foods, of course, too much sugar is also a factor. And there's other sweetening substitutes, things like allulose, and that's ALLUSE, and you can check into that, stevia, monk fruit. There's some of them in small amounts. You can still get the sweetening effect without it affecting your blood sugar and impacting your adrenals, because we need those to be strong for helping with your hormone production. They do play a key part, and that's also when you're too stressed. It also goes into you making more of the fight or flight hormones, which are not going to be helpful for the feed and breed hormones we need in parasympathetic mode. So the sugars need to be brought down because they can also affect your liver, which also affects your hormones. Because if they can't get conjugated well, then you're not going to be making enough of the estrogens you need to get to the right place so that you can build up a good endometrium. So these are like little things, but when they all come together, they can have more impact than you would think. And this goes for your partner too. If they're tested and they actually see that they have these things, it's a little easier sometimes to get them to do more, whether it's supplementation, dietary changes, those types of things. And sometimes they need added testing, but we'll talk about that in a sec. So the lifestyle habits are really important, and you want to make sure you're looking at those first and foremost, because the cleaner you have your system overall, it's going to make it more conducive for you to be able to conceive. Your body's going to be working for you instead of potentially against you in that way. The other thing to be looking at is if you haven't ever been tested, like if you know you get painful periods every month, or you get really heavy bleeding, or you're always getting more breast pain before your periods, or even at ovulation, you notice some changes in that way, that can be more of a hormonal imbalance. So getting tested to find out what's going on so you know how to take care of these things. What's going to be a better way of regulating estrogens? What's going to be a better way to help bring progesterone up when you need it to during that luteal phase? Because that's what helps hold and actually helps you get pregnant, but also staying pregnant. That's why the progesterone needs to be at a good level. And I normally suggest that women get theirs checked mid-luteal phase, because you're not going to know how well it's staying up and helping that conception occur if you're only testing it on day 3. Because if you're having a 28-day cycle, you want to do it midway between your ovulation and your next period. If you're really irregular with cycles, I understand that can be very difficult to find out. And so you just have to kind of do your best of when you think you've ovulated, if you're having those good signs with, the good cervical mucus. And I mean, that's one of the big factors, but those kinds of changes, maybe you get a little bit of cramping around ovulation, the middle schmerz, that's possible too. So you're looking for those kinds of signs of changes, and then you'll know, okay, so about at least 8 or 9 days later, that's a good day to check progesterone. And this is especially, if you've not gone to the IVF stage yet, because usually they'll be checking your hormones, or they'll automatically with an IVF be putting you on progesterone. But I'm trying to talk about before you have to get to that point, is knowing where your hormones are and being able to do things in your diet and lifestyle that can help the progesterone levels too. So there are definitely things you can kind of keep in mind at that point where you're helping your body work overall so the hormones can be doing what they need to do at the right time. Besides knowing about your hormones, the other thing is if you are having some of those symptoms I mentioned with more crampiness and heavier periods, a lot of pain with that clotting factors, then actually getting checked, going to your doctor, and if they refer you on to a fertility specialist, it's fine, but you want to be able to find out if there is anything like PCOS going on. You can tell with some of the hormones too if they go further and check for your luteinizing hormone. A lot of times that will be elevated when there's more factors with PCOS. So you want to be looking at a full hormone panel. And these are things when you go in and talk to your doctor and you're trying to figure it out that you can be asking for too. You can say, I understand, I really want to find out if I have this taking place, because they may not always go to that right off the bat. Is doing a ultrasound, checking for any fibroids. Endometriosis is harder to spot. It can be quite the chameleon, but it can also have it can have a negative impact on trying to conceive. So a lot of times they'll look for that after they've checked everything else, kind of going through that process of trying to figure out what might be impacting it. So endometriosis is something they will check further on, but if there's any endo in your family, or if you are having really painful periods, a lot of times that can be an indicator. And so you want to make sure you're looking for those things, because anything that's creating more inflammation in there it's going to make it more difficult for implantation to take place too. So you want to rule things out. So the more you can find out through your doctor first off and be able to take steps, the better chance you're going to be able to do some things to help it and potentially avoid having to go through IUI or IVF. And so this is like trying to set the baseline so you're not having to do that yet, not having to look towards it, but things you can do, yourself and at home. Male factor things are another one that you need to be taken care of. So having your spouse or partner checked for, first off, for sperm and making sure it's all viable and then there's enough of it, and that their swimmers are good, and that there's not a lot of dead sperm that's in there. So checking for those things, but also if there are signs that things aren't so great, is checking for a varicocele, which is, something that's going to be like a varicose vein, not like, it is a varicose vein in the testes, and that causes too much warming, which can kill sperm. So having that checked, especially if they're sitting a lot at their job, truck drivers notoriously can have things of that nature happen because they're sitting for such long periods of time. So you want to rule out anything that might be happening on his end. And then besides that, also making sure there's no viruses or bacteria present, because those also can have an effect, can kill sperm, can hinder getting through. And then even on your end, checking for any STDs for both sides and any kind of infection that could be impacting you being able to get pregnant, even affecting the actual microbiome of your vagina, because it's got to go past that, the sperm does, to be able to get up to your fallopian tubes and inseminate an egg. And so if there is a environment with HPV present can do it, but also Candida, other factors can impact how good the environment is for the sperm to survive. So checking on those things is really good for you to do as well. Other than that is being careful about exposure. Exposures are a big one for pesticides that are getting sprayed in your neighborhood. Try and avoid being out when that's happening. Making sure that if you've been around a lot of toxins with work, that you kind of test for that and make sure that they're not still lingering in your body, because anything that's causing that or putting that into your system can cause or lead to more inflammatory factors in your bloodstream, etc. And so we're trying to get rid of and eliminate anything that could be standing in the way, no matter what age you are. So that's really important. And so, and I should say it includes environmentally the water you're drinking. Make sure you're getting good, purified water, not the stuff directly from the tap. I would say better than better than some of the plastic ones that you might be able to get in the market. I know they're cheaper, but you want to make sure you're getting one that's going to really get rid of the majority of contaminants that are coming through the water. And make sure your air's clean. Check for molds. There's a lot of things that I'm talking about. You're like, gosh, that seems like a long list of things to do. But we're just talking about your health, your partner's health, and making sure that you are in the best place physically, spiritually, emotionally to be able to conceive, especially if you're trying to avoid going those extra steps down the line. So whatever you can do now is going to definitely help you, especially if you're preconception, like if you're just starting to think about it. But even if you are in the midst of really wanting to conceive, the more you can do now to clean up home environment and the environment around you, and then check on some of the things I've already talked about, it's going to really help so much more, especially with holding a pregnancy, having a healthy pregnancy, and you feeling better during the process. So those are all super important. You do want to feel at your best. Lastly, is kind of talking about that mental stressors. And so just making sure that you're doing more things for you, not overdoing it. And I've talked about affirmations in past ones, but really trying to get your vagus nervous system in a place of feed and breed, which means more laughter therapy. Since your vagus nerve runs through here, anything that stimulates or causes vibration here can really help. So hard gargling, singing, humming, and those are things you can do in the car when you're driving from one destination to the next. Or you can also be doing the breathing exercises too, which are really good. The more you can focus on nice deep breaths and getting away from stress factors, the more it's going to be helping your feed and breed hormones work the way they're supposed to. So I know this is a lot, and I will have more of like where it's noting these things out in the captions below. So please check on that so you can remember what steps you need to take now if you're really trying to get in your best shape and health for conception. These are things that are really going to do that for you. So take care of yourself in the meantime, and I'll talk to you soon.